WWJ.
Good morning. I'm Brooke Allen. Our top story this hour, it is going to be a scorcher once again today. The Metro Detroit area expecting highs in the 90s, but it's going to feel more like 100. Joining us on the live line with some tips on staying safe in the heat is Dr. Rob Cleaver, Director of Emergency Medicine at DMC Detroit Receiving Hospital. And Doctor, thank you for joining us. Tell us, what are some of the dangers associated with temperatures this high?
Well, the obvious danger is you can get a heat stroke where it starts to affect your brain, where it very much mimics a stroke. But the other complications we see are, dehydration, and it really affects the people at risk are the young and the old and the people with pre-existing medical conditions, especially, people with high blood pressure and heart disease and diabetes.
So what kind of things should people do to protect themselves if they need to be outside today?
If you need to be outside, stay inside unless you need to be outside. And if you have to be outside, please, make sure you're drinking a lot of water or Gatorade with electrolytes in it, and try to keep it cool, even if you're not thirsty. You can lose up to an ounce a minute, especially as some of our landscapers are. Wear a wide brim hat that keeps the sun off the back of your neck. Get cooling towels and cool yourself off. When I was training for a marathon a couple of years ago, I'd just make short laps of a mile, and I had an ice bucket outside where I had rags that I just cool myself off between my mile laps that I did. But just if you really can be inside and in the air conditioning, please stay inside. Okay,
so I know my kids want to go to the park no matter the temperature, but are children more affected than adults by extreme heat? Is that okay, or what? What about the kids?
So I think overall the elderly, are more affected than kids. But the problem with kids is that the kids have a lot of surface area of their body compared to their weight. If a kid weighs 50 pounds compared to an adult that weighs 200 pounds, when they start losing water. So with the kids, it's good to get them in the pool, get them playing in the sprinklers, but give them water even when they're not thirsty. Make sure that they're urinating enough. That's a real easy test to make sure that they're drinking enough water. Look at your kid's urine before they flush it down if they can't tell you reliably, to make sure it's not too concentrated. And then, use your parenting skills. If they seem tired, get them inside, cool them down.
What are the signs of dehydration?
Signs of dehydration, the first sign is going to be really being thirsty and being fatigued and just not feeling well are probably the big signs that you see are with dehydration.
If you are spending time in a pool or even a lake, are you protected because you're near the water from becoming overheated, or no?
It helps out a significant amount, especially if you're talking about anything. Your body temperature is 98.6 degrees. So if you're in a water that's 80 degrees, which is a comfortable swimming temperature, even 85 degrees is pretty comfortable. That's going to help keep you cooled off. And then when you get out, if you can get in a fan and get some of the evaporative cooling effect, that will help out. But one of the things when you're in the water, you're not usually drinking a beverage. And if you try to avoid the alcoholic beverages today. Just make sure that same thing. When you get out of the water, you have a cup of ice water or some Gatorade or something else to help keep you hydrated.
Okay, so when should people head to the ER?
If you don't feel well and you're concerned or you're feeling lightheaded or dizzy, chest pain, shortness of breath, I know that every ER in the country, and I know in Metro Detroit, I have friends that work at other ERs, are pretty busy, but we're open 24/7, and we'd love to take care of you and help you out. That, you come in and we'll check you out and we'll evaluate you. And if you need laboratory studies or IV fluids, we'll do those as appropriate.
Okay, I know obviously with COVID and the Delta variant on the rise, people are hesitant to head to the ER. But it's safe, correct?
It's safe. We're separating our COVID patients, or what we call PUIs, or people under investigation from COVID, from our people that aren't under investigation. So, like myself, I'm vaccinated and I'm healthy, I have no symptoms. If I came in as a patient, I'd be in a totally separate part of the ER than the people that have a runny nose or cough or congestion. At all the DMCRs, we are vaccinating people for COVID. So if people would like to come down and get their vaccine, we're doing all three of the vaccines, the Moderna, the Pfizer, and the Johnson & Johnson. So that will help keep you protected against that too. But, the ERs are safe, and we're doing a great job with our staff, especially our nurses, keeping everybody separated and safe.
Okay, thank you so much. We've been speaking to Dr. Rob Cleaver, Director of Emergency Medicine at DMC Detroit Receiving Hospital.